Yeah. No, you're the one that told me last time I was here.
Exactly. Dr. Muller,
I'm on it.
side.
I'm on it.
Side, the
Okay.
side. Okay, hang on
I'm
one
all over it.
second. You do whatever you want, honey. We're live? Okay, we're live on Facebook. Hey, guys, we've got about a minute, please, before we go to live on vinyldraftradio.com. If you do not have Facebook or have a friend that would like to watch the show today, then go to vinyldraftradio.com. That's VINYLDRAUGHT radio.com.
And we're live streaming on my Instagram feed
right.
on Doc Molliver.
Doc Molliver, that's right, on Instagram. Okay. I'm trying to go to, why is this not working?
All right. So for those people on my Instagram feed, I'm on the Kelly Williams Show. This is vinyldraftradio.com. And on their Facebook site, you can follow her. She has a radio show on Wednesdays. It's a great show.
It's an awesome show.
It's an awesome show.
Because you're on
really
it.
funny. And I'm on it every Wednesday morning. The first Wednesday,
Wednesday of every
month,
morning.
Right? Today we're going to talk about
I'm trying to find the show.
things you can do right before the holiday season.
That's right. Quick fixes, which is a huge deal for a lot of people.
Absolutely.
You know, that's the world we live in. Refresh. Thanks, Leon. I don't even know what I'd do without you. It's not going
So if
anywhere.
you have any questions, post them on the Instagram feed. I've got it set sideways, so I may have to turn my head to read them. So.
Why is my computer not doing?
Maybe we can turn it this way. Oh, that's even better. Let's do that. Hope I didn't get you.
Why am I not doing? Hold on.
Ah.
You get to see the technical difficulty.
Sorry about that, folks.
Right before the show goes. Leon and Tegan, am I in the center? Thank you. See, I learn. I learn quickly. You just have to tell me sometimes.
Absolutely.
I did. I found the show.
So you can do that with fillers.
Thanks, Leon. I
and
appreciate
cover up
it.
a lot of small deformities
find
of the top of the nose.
How do I find the...
But I'll talk about that in just a minute.
Oh, the comments. There we go. Hey, Arilee. Good morning.
Good morning, everyone.
All right.
So, someone just posted, do I recommend non-surgical rhinoplasties? That's a really neat topic. We haven't touched upon rhinoplasty too much previously.
No, but we're going to.
But non-surgical rhinoplasties, I didn't even think about that for this segment. But what we do is we inject fillers.
Yes.
And you can actually adjust the tip of the nose, adjust the dorsum.
Well, hang on, because we're going to talk about that.
We're going to talk about it just a minute.
That is on the list. So hang on, whoever asked about...
My wife is on here. Hey, Michelle.
Hey, Mrs. Doc Molliver.
Mrs. Doc Molliver.
My hair has a rat nest. This is really loud. Hello? Hello? All right. Good morning. How's everybody today? Yay!
Awesome.
It's the Kelly Williams Show. Happy December. That is right. I am so happy to be here. You know, I wasn't here last week. I was sick. But T. Shaw, Beyonce, took my place. He was a pretty awesome Kelly Williams for the Kelly Williams Show. Thank you, T. Shaw, if you're out there listening this morning. Okay, good morning. We're live from the ACU of Texas studios. Pretty awesome in here, isn't it, Dr. Molliver?
It is awesome. You guys added all kinds of cameras and lights. It's gotten really uptown here.
It's pretty awesome.
It is pretty awesome.
So for the show today, everybody, we've got the fabulous Dr. Clayton Molliver of myhprs.com. That's Houston Plastic and Reconstructive Surgery right here in the Clear Lake area. Okay, so we're talking about something that really everybody wants to know. Quick fixes before the holidays, because this is huge. You know, and I looked this up. Mm-hmm. You know, I'm a big researcher.
I'm ready. I'm ready for you this time.
That's right. Okay, so I read between Thanksgiving and New Year's is when there's a huge increase in cosmetic procedures.
Absolutely. We're just jammed
like 25% at least that they can count. Yeah. So, you know, and most people won't say they had anything, so they're not even included in the 25%.
That's exactly right. Not me. So I didn't do anything.
Right. I didn't do anything. I just look fabulous. Thank you.
That's right.
That's right. So you can kind of get an eye lift to go with your new outfit.
There you go.
You know, I mean, what's better than that? Heck, you know. Okay, so now that we found out that there's so many procedures, between Thanksgiving and New Year's. How busy are you right now? Are you crazy?
I was already in the operating room this morning.
Wow.
My associate has got a case right now, and I'm going back for the rest of the day right after this. So this is a very, very busy time of the year for us.
Yeah. So tell us what the most popular quick fixes are that somebody will call you and say, hey, I need this done. I'm going to a party, or I have a wedding, or I have an event. I need this done. Can you do this for me?
Well, I think everyone that's familiar with plastic surgery or the cosmetic field is aware of Botox and Juvederm and these fillers. And I think those absolutely are the most common things. But a lot of people aren't aware of the things that you can do with them.
Yeah.
So, for example, someone just typed in, how about non-surgical rhinoplasty? Absolutely.
Yeah.
So most of these, are done with a blunt cannula, so that you shouldn't use a needle, so that there's very little risk of bruising nowadays. People do bruise occasionally, but it's easily covered with makeup if need be. But give yourself, 2, 3, 4 days before you have to go someplace or be seen.
Okay.
And it's going to be best to be able to cover it if you should have a tiny bit of bruising. But for example, on the nose, a little bit of a bump, a little bit of something on the tip of the nose, we can put filler in, and the fillers nowadays last for up to a year and a half. So if you have a little bump on your nose and you've always wanted to correct that can be corrected by filling in the area just on either side of that little bump and smooth it out. And, and it looks like you've had a rhinoplasty.
I mean, that's really huge if you think about it. I mean, because somebody could be struggling with something most of their life, and they just want to try out getting something done.
We can lift the tip of the nose by injecting at the base of the nose.
Yeah.
We can put in some on the top of the nose to smooth out and any bumps that you might have had from falling off that horse when you were 5, or getting hit by your brother with a baseball bat or whatever.
Or golf club, whatever it is.
Exactly. And then the other thing is Botox. Botox is great. And people don't always realize all the things that it's used for.
Yeah.
So I see a lot of guys come in who say, I'm in this position, that position, and I've got this frown. I played football, and with the helmet pushing on your horns just fell off.
My horns fell off.
Yeah. The helmet pressing on there, it caused my brows to be in or whatever.
Yeah.
And those frowns make you look like you're sad or concerned or upset. And if you're a bigger guy, that might be a little bit imposing. So we see guys come in and say, "What can I do?" And the first thing I say is, "Well, you look like you're upset with me."
Yeah.
And these are happy guys,
What did I do?
Exactly. A little bit of Botox between the eyes, right up there. Just release that frown.
Yeah.
And you look more serene, more calm, happier. Of course, crow's feet, furrows across the forehead. When I was on my way here, Dr. Fred Aguilar, my buddy at my practice.
Hey, Fred.
He's in the operating room right now. I hope he's not listening to this, right?
Let's hope it's not streaming over the operating room.
He said, don't forget to talk about the neck.
Yeah.
So sometimes we get these bands in the neck when we're animated, when we tuck. Yeah.
Right.
And some of these bands, you can put a little bit of Botox in, and the skin will just drop into the neck and smooth out.
Wow.
And it's really a nice effect. Botox takes 3 to 5 days to kick in.
Okay.
And so this is something you can do right before the holidays. These are the kind of things that work really well. The Botox, the Dysport, and the fillers. On the filler end, we have lots of different kinds now. We have kinds that will go in the lip or just above the lip in the little tiny creases. Or we have fillers that will go in the deeper grooves of the face or in the cheeks to pump them up a little bit.
Yeah.
You mentioned earlier the lower eyelids. Well, the eyelids in general are something that is really a quick fix, but you have to be careful.
Yeah.
You can do. I've done eyelids, and I've had people, women back in makeup in 3 days and looking pristine.
That's amazing.
But I've also done a few where they bruised, and they bruised for 2 weeks.
Yeah.
So you got to be a little careful if you're looking for a Christmas to look great for this Christmas dinner.
Yeah.
You got to be a little careful about thinking about it, because if you're someone that happens to bruise, you can have a problem. So you have to approach that very carefully.
Yeah. Well, okay, before we move to have another question about eyes that my daddy just sent in, have you ever thought about doing a commercial for Juvederm and said, we're going to pump you up?
Actually,
like Saturday Night Live shows.
Actually, so
that actually works.
Do you remember the car commercials down here in Clear Lake? You don't have to go to the big city to come on down.
Yeah.
Or whatever. Well, I actually thought about doing a commercial for that. Come on outside the loop for your breast augmentation.
That's right. That's hilarious.
The problem is that we have offices in Pearland and Houston and here, so I'm not just outside the loop anymore.
No, that's right.
So
that's right.
I thought about that.
That's right. Well, you might think about that.
Yeah, pump you up, huh?
Pump you up. Hey, okay, so my daddy is asking, he actually had lens replacement, which we were talking about just a minute ago.
Right.
He has bags under his eyes that have kind of formed or gotten worse after that. Is there something you can do for him, or what kind of options are there for him?
Well, first of all, even though lens replacement, cataract surgery, LASIK surgery is so routine these days, and for the most part, 98% of the time are complication-free and do fine, it's still surgery, even though it's minimal. Most people don't have appreciable swelling at all, but some people will have some. It's a surgical procedure. I prefer not to go and do lids around the eyes after someone's had those kinds of things done for a few months.
Okay.
So I would let all of that totally resolve before I went in there. Beyond that, sure, it all depends upon how much laxity there is, how much fat maldistribution in that lower lid there is. It's a lot more complicated than just saying, well, I'll do your lower lids.
Oh, okay.
Sometimes there's like 5 or 6 different procedures we might do on the lower lid.
Okay.
Depending upon how much laxity the lower lid has.
Okay.
Lower lid's pretty weak. And if you get some swelling, it can pull down, and that's a bad look.
Oh, okay.
So it's a bit more complicated. Upper lids, on the other hand, are pretty straightforward, and that's something we do under local anesthesia frequently. And it takes about 30 minutes for bilateral upper lids.
Wow.
And easy, fast, quick fix, and really cleans up the eyes pretty nicely.
Yeah.
However, the other thing you can do on the lower lids is the tear trough. So we get a little bit of a trough there on the lower lid. We call it the tear trough, and that can be filled with filler. So we can put filler in there by a skilled person, Dr. Pittman at our office, or Dr. Aguilar in town in Houston does a lot of filler, and we can fill in that crease, that fold. Makes you look 10 years younger.
Wow.
So that's a quick fix also.
Okay, so for puffy bags under the eyes, it's on a case-by-case basis, kind of seeing what you're dealing with?
Exactly. If it's a little bit puffy, you can camouflage it with a little bit of filler. If it's more than that, it's usually a lower lid blepharoplasty, and that's more involved. And you really need to see either an oculoplastic ophthalmologist who specializes in plastic surgery around the eye, or a board-certified plastic surgeon to assess you and see what's going on.
Oh, okay. See, that's good. So can they call you for a consultation?
Absolutely, they can call me.
Where can they call you for this fabulous consultation?
We have so many numbers, I can't even remember them all. But our main phone number is 281-282-9555, or go to our website, myhprs.com.
Okay, awesome.
Shameless plugs.
That's right.
We like those.
We do like shameless plugs here. We're all about that. Okay, so what about chemical peels? And I know we only have a little over a minute before we go to our first commercial break, but chemical peels is a big one that a lot of people have asked me to ask you, because how long do those take? Is that something they can do at a lunchtime appointment, or does that take a little bit longer, or does it depend on the person?
That's a great question. So for a lot of years, people would market them as a lunchtime peel.
Yeah.
But the reality is that there's all kinds of different peels. We offer VI peels. We offer glycolic acid peels. We offer trichloroacetic acid, or TCA peels, and in different strengths. And so you really need to be seen by a plastic surgeon or our medical esthetician who's been doing this for years to assess what type of peel you need, how much downtime you're willing to take, because if we're a bit more aggressive, we can get a better result, but it might take you 5 to 7 days to heal over. On the other hand, some of these light peels that we offer, 2 or 3 days, you get it done on a Thursday or a Friday, and you look fine by Monday.
Wow.
And it'll lift off the little brown spots. It'll buff out those little fine wrinkles.
Oh, yeah, that's pretty awesome.
Clear up your complexion.
Yeah.
So those are a lot of things that you can do leading up to the holidays, or just anytime you want.
Okay, so you can have a micro peel or something like that during lunch, but you may not be prepared to head back to work. right after,
Well-
depending on the redness. If you're like a receptionist, that may not be a
That
good
may not be
idea.
the best thing. Although, these days you see people with this and you say, "What
Yes.
happened?" I had a peel, and everyone's like,
Exactly.
"Oh, okay."
All you can say is, "I just got back from vacation."
Well, it was just. I was in the Alps. I got too much windburn.
That's right.
Skiing the
Wear
Alps.
the thing around your eyes,
That's
while
right.
they're doing it, and then they have the ring around. I was skiing.
That's right, I
Thank
was
you. It'll be
skiing.
gone in just a couple of days.
Exactly.
Yeah, exactly. So, okay, when we come back from commercial break, we're going to take some more questions that people are asking you.
Okay.
Stay tuned right here, Facebook peeps, because we are with Dr. Clayton Molliver right here on VinylDraftRadio.com.
All right.
All right.
Okay, Average. I've got some questions. Well, first of all, let me give a shout out to Ink Boutique Houston. If you want to see some just amazing microblading, which is something else we didn't mention, but that could be done, and about a week it
What's
heals over.
microblading?
So
I wanna talk
microblading
about that.
is the eyebrow tattooing, and
That's right.
I want to do a shout out to Shara Juarez. Shara, you can go to her Instagram feed or her Facebook site. Facebook's been giving her a hard time because she does 3D reconstructions, micro tattooing for breast cancer patients.
Oh, I love that.
She makes nipples that, a foot away, you look at them, you say, "Oh my God, there's a nipple."
That's
And there's
amazing.
an areola, and there's
Yeah.
the little glands in the areola,
That's
and
amazing.
she tattoos all that.
That's incredible.
It's like she's an artist. She's
Yeah.
like painting. You go to Ink Boutique Houston. That's her Instagram feed. You'll see the most amazing work. I've seen tons of work over the years, particularly facial tattooing for eyeliner and lips and eyebrows.
Yes.
She, by far, is the best I've ever seen. It's amazing. When she puts little hairs in eyebrows, they have little tiny irregularities to them. They're not just all going the same way.
Yeah.
They're just terrific.
That's
So,
incredible.
Shout out to Shara, and she also helps a lot of women with breast cancer and doing their reconstruction, finishing it out with the tattoo of the areola and the nipple.
Oh, that's really awesome.
And
that's
she's
wonderful.
She's
That's
been
really
featured.
helpful to
She's been
people.
featured on all the major news stations here.
Wow.
And she was on the Deborah Duncan show.
Wow.
She's just she's like the best one in town. She's amazing.
Wow.
Average cost for a non-surgical rhinoplasty. That's just a syringe of filler. Somewhere between $500 and $800. I think that's about the price, isn't it?
75 is the
About $675.
Okay, well-
I'm looking over there at Miranda. Miranda's our marketing
And
director.
Dr. Molliver will be answering these questions live on the radio as well in
I'll
just a
answer it again.
moment.
I'm just
He's
answering
gonna
my,
answer, but
my
we want
Instagram
to
feed.
we want to talk about that as well in just a moment on the
Cool.
on the Facebook.
Okay. We'll repeat it for Facebook.
That's
feed.
right.
There you go. Let me get a little slurp of coffee here.
Because I've got some more questions coming in, so we're gonna. Okay, let me answer some text real quick. How many? Thank you, Leon. Thank you. You look fabulous in your hat, by the way. I love it.
More questions coming in. All right.
Thank you. Dr. Molliver, is your microphone, your earphones are okay?
Everything's good.
Excellent.
I'm good. Good to go.
How long? Oh. All right, welcome back. Awesome. We're so excited you're joining us right here on Vinyl Draft Radio. We are live from the ACU of Texas studios with the fabulous Dr. Clayton Molliver from Houston Plastic and Reconstructive Surgery in the Clear Lake area. But you actually have 3 offices, so tell us where your offices are located.
So we have offices in Clear Lake, the Webster area, where we have our freestanding surgery center. It's a 6,000 square foot freestanding
Yeah, it's
building,
beautiful.
very private.
Beautiful.
We have our own OR, fully accredited. We have offices in Pearland, and then we have a beautiful office on Bins in the museum district.
Oh, nice.
Yeah, and I'm really excited. Barnaby's is downstairs. I'm really excited about the food.
Wow.
Barnaby's is downstairs, and Fadi's is coming in downstairs
Wow,
as well.
that's fun.
So, and they've got a great Japanese barbecue place, but it's outside the medical center. It's on Bins. We have our own surgery center in the building. It's a cool place. nice access from 288. So I see patients there, and Dr. Aguilar sees patients there.
Nice.
Yeah.
Nice. Leanne, I'm not hearing good in my earphones. I'm sorry. I just wanted to let you know, just so I can hear everything. Thank you, sir. Okay, so we've got some
more questions.
We've got questions coming in.
Quick
Okay,
fixes.
so now Yolandini said, I have under eye bags as well and was told it's hereditary. Are they hereditary? Is there a fix for them if they are hereditary?
So that's a great question. Sometimes we see people who have, quote, bags under their eyes, and they say to you, look, I've had bags under my eyes since I was 7 years old.
Yeah.
Well, how can that be? You know,
Yeah.
we usually see, you usually see people.
Child labor.
That's right. Up too late studying with a tiger mom. Make those grades.
That's right.
But really what's happening there more often than not is some people have born and have, a chin that's a bit small
Yeah.
or a nose that's a bit big.
Yeah.
These people have the bone underneath the eye that's a little bit back.
Oh,
All
wow.
right? And so it's a little bit back. We call it a negative vector eyelid. And because it's back a little bit, the eyeball is sitting this way or this way. I'm on radio. I know. I'm
He's
supposed
pointing
I know.
to
We've
the
got
left.
cameras. Yeah. So the lower eyelid bulges a little bit.
Yeah,
And the worst
wow.
thing you can do for these people is go in and take the fat out like we used to do years ago.
Okay.
So you really have to be seen by someone to assess them.
Okay.
In the past, we'd put a little silicone implant in there.
Wow.
And I used to do a lot of those, and we don't do that very much anymore. Now we have fat grafting. Now we have fillers, so we can pump you up, like you were saying before.
Pump you up.
Yeah,
You got to use the accent, Dr. Molliver.
Bump you up.
There you go.
There you go. we can build up those areas on the malar area, the orbital rim, and that takes away the appearance of that bulging lower lid. So I
Oh
see
my
people
gosh.
come in, they're 25, they're 28, they're 32, and they go, I hated it. People ask me, why haven't I slept? Or,
Oh my
am I
gosh.
tired?
Yeah.
And it's like, oh no, I've had them since I was 7, everything
Yeah.
I can remember.
Yeah.
And you look at them sideways and you see that orbital rim is backwards a little bit. It's
Wow.
depressed. And if you just build that up,
Yeah.
the little bulge goes away.
Amazing.
Yeah, that bag
Amazing.
under the eyes. And sometimes those bags are really prominent.
Yeah,
so
that's
sometimes
incredible.
it's counterintuitive. You think you want to take the bag away, and that makes things worse on these particular kinds of eyelids.
Yeah.
So again, you need to be seen. There's lots of different variations.
Yeah. Okay, so just to recap, the people that have puffy bags
Right.
under their eyes, that just needs to be, you need to see them to see what kind of procedures can be done to help that, because it's probably a little bit more.
It's
entailed.
more involved. Upper lids, more often than not, it's an upper lid blepharoplasty, but sometimes it's not.
Yeah.
Sometimes people come in and they go, my right eye is great. Look,
Yeah.
I have no skin. It's really pretty. The left eye has a lot of extra skin, and
Yeah.
they're 54, they're 63. And it turns out that the eye with no extra skin is the problem eye. So
Wow.
we see that sometimes
Yeah.
because in some cases a little membrane is broken and it pulls all the skin back and it looks perfect, but there's other tip-offs. So in all these cases, a complete eye exam, looking for dry eye, talking to them about glaucoma,
Yeah.
looking for lid laxity or droopiness of the eyes.
Yeah.
There's a lot involved. You need a complete, good evaluation before you go ahead and do blepharoplasty on anyone. And of course, that's what a board-certified plastic surgeon, that's what an ophthalmologist is going to do. They're going to assess you.
Yeah.
So it's
absolutely.
not quite so straightforward. But on the other hand, more often than not, an upper lid blepharoplasty is a quick and easy procedure.
Okay, so give us the quickest things that people can do before the holidays.
So light micro peels, as you call them.
Okay, and what's the
glycolic
recovery
peels,
time on that?
2 or 3 days.
2 or 3 days. How long does it take?
Takes about 10-15 minutes.
10-15 minutes, and that's the
lunchtime
micro
kind of
peel,
thing.
you
Yeah,
said?
you can call it micro peel. VIP peel is one of the products
I
we
like
use.
VIP peel.
It's for very important
Yeah,
people.
exactly.
Right,
They're,
yeah.
we're all, our listeners are very important
They're
people.
very
Call in for the
important.
VIP
Exactly.
peel.
And of course, Botox, Dysport,
Yeah.
fillers. These are all really easy things to do for competent practitioners. We have physicians in our office that do all of our fillers.
Yeah.
And the results are immediate. You want to plump up your lips a little bit.
Yeah.
You know, you want to take care of that nasolabial folds, those folds on the sides of your mouth.
Yeah.
You want to fill those in.
Yeah.
You want to get rid of some of the wrinkles around your eyes, your forehead, around your mouth, on your neck. These are areas Botox, Dysport works really well. Takes about 3 to 5 days to kick in. And complications are extremely minimal and rare.
Yeah.
So it's very, that's why it's been so successful. And one of the largest growing areas of cosmetic surgery, cosmetic field in general is the non-invasive or minimally invasive surgical procedures or non-surgical procedures.
Yeah, exactly. Okay, so give us the top 5 procedures, how long they take, if any of these, which ones are lunchtime.
Wait a second, this is a hard question.
Which ones are lunchtime procedures?
Lunchtime procedures are Botox, Dysport, a light chemical peel. I would not do Kybella. So you've heard about Kybella. Kybella is a medicine we inject, for example, under the neck, under the chin to get rid of a fatty area.
Yeah, it like melts the fat
it
or
melts
something?
the fat.
Okay.
I would not do that leading up to the holidays.
Okay, good
You're going to have
call.
some prolonged swelling. You're going to be wearing a lot of neckerchiefs and whatever to camouflage.
Neckerchiefs. That's hilarious.
What do you call them? Scarves.
Handkerchiefs.
Handkerchiefs, whatever.
I love it. Just put a little scarf. Put a little scarf.
A little scarf.
A little scarf.
Yes,
That's
I
right.
would not do that one. So Botox, fillers, light chemical peels. You could do an upper blepharoplasty, but you better get in tomorrow.
Call today, immediately.
Most of us are pretty filled up, so I think that one's
Yeah.
off the books.
Yeah.
Liposuction. You could do liposuction. A month ahead, 2
Wow.
2 weeks ahead.
See, this is good to know.
Yeah, you could do liposuction and knock down that waist a little bit.
Yeah.
And do fine 2 weeks before an event.
Wow, 2 weeks before. That's pretty awesome.
Well, you'll be, for example, in liposuction, most of the time, unless it's massive liposuction, which most of us don't do, but if it's sculpting, body sculpting, you can do that and be back to normal activities in 2 days.
Wow, that's
Yeah.
amazing because if I want to go buy an outfit and then I need you to make me skinnier,
There you go.
I can do
you
that.
want to fit in that one size smaller? We have
just
the
for
technology.
that day.
Yeah.
Just that day, and then I want to eat.
And for that matter, some of the other things, the lasers really are quick fixes as well. IPL works pretty nicely.
No, what does the IPL
Intense
do?
pulse light. That'll take out some red spots, some brown spots.
Awesome.
That works very well.
Awesome.
We have some non-invasive fat reduction machines that are totally no downtime at all. Takes about 40 minutes, and it will reduce you an inch.
What? That's incredible.
Yeah, it really is.
So how long does that take, you said?
About 40 minutes.
About 40 minutes. So that could be a lunchtime
It could be a lunchtime
fix.
procedure. Yeah.
Okay. So give us the phone number that they need to call to contact you for their consultation. Do the consultations cost anything, or are they free?
No, our consultations are free.
Okay.
You can meet with any of our surgeons. You can meet with our esthetician or our patient care coordinators. You can call 281-282-9555. And that number is good. We have specific numbers for our Houston office, for our Pearland office, but that number will get you to all of them. And we can book you to any one of our clinics to see any of our doctors from that number.
Oh, that's great. So it doesn't matter really where you live. That one number is going to get you.
All of them. Houston,
you can get an appointment
Pearland,
anywhere.
here. Yeah.
Okay, so what about a tummy tuck where you actually tuck their stomach in their pants for that night and glue it so they look good?
I've got something even better.
What?
I've got something even better.
I don't know.
I have developed a new technique. I really have not wanted to talk about it. It's been a black market kind of thing. But nowadays people are getting piercings and and body art and whatever. Pocket plasty. Have I talked about pocket plasty out here yet? I don't think I have. So I developed this technique where people they've lost a lot of weight or they've had a few babies and they've got some extra skin hanging around.
Yes.
Well, instead of throwing it away, I make pockets out of it, like a kangaroo, like marsupialize.
Ew.
We make pockets out of them. I'm serious. You got someplace to put your change, your credit card.
So you're making your fat useful.
Well, it's the skin.
The skin useful.
Yeah, we're making the skin.
Extra
We
skin
make
useful.
pocket. Now the problem is that sometimes there's problems with our pocket plasties.
Oh,
then
that's a shame.
Then you have to do pocket endoscopy.
Yeah.
But my GI guys are very happy. It's a spin-off, and they've got another procedure to do.
But doesn't that cause do you ever have lint buildup?
Yes, yeah, it's kind of nasty. So we went down to South Beach. We went to South Padre Island during spring break, and we do pocket plasties on these young girls and guys.
Nice.
And then they come back to town, and the family's like, "Oh my God, what did you do?" So we have to do pocket-ectomies. So, but this is not really true.
Oh, yeah, no, of course not.
no.
This is fake news.
Fake news. There you go.
But it is kind of fun, though.
Yeah, it is.
Yeah, you never know. I mean, I'm thinking that at some point there'll be an app, and you'll probably design it, come up with it, where you stick something in the phone,
Right.
and then you can do your own lipo.
There you go.
Like you eat too much, lipo, real
There you
quick.
go. There you go. Just wave the phone over you like a tricorder
That's
in Star
right.
Trek.
Something, you're going to come up with something like
There you
that.
go.
You know,
Actually,
'cause it's
this morning
immediate.
I was thinking about the show, and I was thinking, what will it be in the year 2100? We just pick out a face and say, I want this face, and just put it on like in the Schwarzenegger movie.
That's right.
Yeah.
Exactly. I
Yeah.
love it. I
Yeah.
love it. Okay, well, real quick, I have another question from Angie. She said, what can dry eyes do to give your bags under the eyes? Does that cause bags under the eyes?
I think that's a better question for the ophthalmologist.
Okay,
I'm going to stay away from that
ophthalmologist, Angie.
one. But we do look for dry eye and those problems.
Yeah.
And there's different techniques to help it. Interestingly enough, I'll tell you something, an interesting thing about dry eyes. One of the signs of dry eye is a eye that drips a lot.
Wow.
So it's paradoxical. You'd think, well, my eyes are dry. Well, it turns out your eyes are dry because you're not producing the oily type of lubricant for your eyes. So
Wow.
you overproduce the tears.
Oh my gosh,
So
that's good to know.
So if you're having a lot of tears, sometimes eye drops
Wow.
helps.
Wow, amazing.
Yeah.
Okay, but Dr. Molliver.
Another 30
another
minutes.
show. Another 30 minutes is already
Gone.
gone. This has been awesome.
As always.
So give them the phone number to call you for their free consultation if they need a quick fix for the holidays.
281-282-9555. Kelly, always love coming here.
So
A lot
much
of fun.
Thank you so much.
Don't
And I
forget
need to look into
pocket
that pocket
plasties.
thing. That's
That
right.
doesn't exist.
You can't have too many pockets.
That's right.
Okay, Dr. Molliver, thank you so much. And stay tuned right after this commercial break. We will have Kelly Sargent. That's right, the Kelly Sargent, right here in the ACU of Texas studios. Stay tuned right after this commercial break for the Kelly Williams Show. Awesome, Dr. Molliver. You're so good. So good.